Hello everyone, this is Dr. Sarah Taysir. I'm a pediatrics and neonatology consultant and healthcare consultant on MedSynapse medical platform. Today, I'm very pleased to have Dr. Enas Attia for the second time with us on MedSynapse medical platform. Dr. Enas Attia is a professor of dermatology and venereology in Faculty of Medicine, Ain Shams University, and currently working as a senior consultant dermatologist in Abu Dhabi. Welcome, Dr. Enas, with us.
Thank you. It's a pleasure.
So, Dr. Enas, we will be talking today about a very important topic, which is alopecia areata. So, first of all, can you just explain what is alopecia areata and how is it different from any other type of hair loss?
Alopecia areata, it's an immunological condition where there is autoimmune mechanisms causing the hair fall, usually in patches, but it can be also extensive into big areas.
Okay, so what are the main symptoms of alopecia areata? How a female or a male can know that it's not a normal hair loss and it could be alopecia areata?
The regular type, which is the patchy type or alopecia areata proper, it's very easy to be recognized if there is a small area of bald skin appeared, whether on the scalp or in any other areas. Particularly in males, some males will find that these patches can affect their beard area, for example.
Okay, and are there many types for the alopecia areata or different stages?
Yes, there is the common type, which is the alopecia areata,
yes,
that we know, and there is alopecia totalis, which is total loss of the hair follicles from the scalp, and alopecia universalis, which is loss of the hair from any area of the body.
Okay.
And there is also uncommon types, such as the ophiasis type, which comes in loss of the hairline behind the ears and the backside of the scalp. And the ophiasis inversa, which is the reverse, which is loss of the hairline from the frontal scalp.
Okay.
And there is a diffuse type, which is similar to the telogen effluvium or the diffuse hair loss, but it is proven to be alopecia areata by dermoscopic examination or by biopsy or both.
Okay, and is it more common in females than males?
I mean, there is no big studies, big studies to define which whose sex is or whose gender which is more affected. So just to say it, there is no big studies to define which gender is affected more in alopecia areata.
Okay, and is there a certain age where this disease starts? Could it affect young age?
It can affect any age, but younger ages are more commonly affected than older ages.
Okay, and you mentioned at the beginning that it's an autoimmune disease. So can you explain more how is it an autoimmune disease, or explain because some patients who have alopecia areata does not know that it's an autoimmune disease. So can you elaborate more about this part?
Yes, it's autoimmune, meaning that there is immune mechanisms against the hair follicles. Some studies, they found that there is antibodies against the hair follicle antigens or against the melanocytes of the hair follicles. This is why we notice in some cases that there is loss of the color of the hair as in the beginning. And also when the hair is coming back, the regrowing hair in the beginning is whitish in color. And there is also other studies, they found that there is other types of antibodies against the hair follicle antigens. Also there is some studies of the immune mechanisms regarding the cell-mediated immunity or the cytotoxic cell immunity against the hair follicles.
Okay, and doctor, how is the severity of the alopecia areata assessed? And can it affect other area other than the scalp, like eyebrows, eyelashes, the body, the main body?
Yeah, it can affect any place.
Okay.
And when it affects particularly the scalp or the eyebrows, the eyelashes, it's making so much burden on the psychological condition of the patients. But it can affect any part in the body. Any hairy part in the body can be affected. Currently, all the assessment of severity are directed to scalp only. But there are newer severity assessment scales. They put into mind the the alopecia areata quality of life affection, and they put into consideration other parts rather than scalp only. The most famous assessment tool is the SALT, which is scalp alopecia areata severity scoring system, which depends on the percentage of affection of the scalp, and they grade these according to mild, moderate, severe, and very severe. Where severe and very severe, it's more than 50% loss of the hair.
Okay, and if one parent is affected with alopecia areata, does it mean that the child has to be affected with the same disease?
It can be, because we find many members in the same family having history of alopecia areata, so definitely there is genetic background and there is a familial background, and also there is associated other conditions such as atopic dermatitis or other immune diseases such as thyroid diseases, vitiligo, so it's interconnected somehow.
Yes, okay. And how is it diagnosed? What does a typical examination involve for diagnosing the AA or the alopecia areata?
A dermatologist, when we look at the patch of alopecia areata, if it is straightforward, it's usually easy to diagnose as alopecia areata as a bald area devoid of hair without any signs of inflammation or infection. But we have to implement using dermoscopy or trichoscopy in diagnosing alopecia areata, because many cases are not straightforward, and because some cases are misdiagnosed as others, and some cases such as the diffuse type, it's also not easily diagnosed, and sometimes also we have to do scalp biopsy or multiple biopsies.
Yes.
The dermoscopy examination, it will not only tell me if it is alopecia areata, but it will also tell me about is it active disease or not active disease. Same applies for the skin biopsy.
Yes.
One type, like the ophiasis inversa, it's coming into the frontal hairline, which sometimes it's misdiagnosed as frontal fibrosing alopecia or with androgenic alopecia. So implementing using diagnostic tools such as trichoscopy, and if further needed biopsy, it's good to do and good to know.
Okay, and what are the current treatment options for the patient who has alopecia areata?
The old options are still there, which are the topical and intralesional corticosteroid injection in case of limited disease. Also, there is the topical immune modulators such as the calcineurin inhibitors. Implementing the hair regrowing mechanisms, whatever the cause can be done, like using Minoxidil, topical Minoxidil, and in severe cases or not responding, oral Minoxidil if it is available, because it's not available in many countries. Using also platelet-rich plasma or platelet-rich fibrin to regrow the hair. All of these are available for many years now. But the newer immune modulatory treatments, particularly for the severe types, is now it's on the focus, such as the small molecules, immune modulatory small molecules, the JAK inhibitors. And currently we have 3 FDA approved molecules. So we have to implement these. And on the run, there is also others are coming on the run. So it's good that we know that there is a hope for patients with such a disease causing so much morbidity, specifically on the psychological state of the patient, that it has now many upcomings in the treatment regimen.
Okay, and regarding the Minoxidil, doctor, some patients are afraid to use the Minoxidil as they know that when they stop using this treatment, the hair will fall back again. So is that right or wrong?
This is only right if we are treating androgenic alopecia, because in androgenic alopecia, when you stop the treatment, the genetic background of the patient, it will work again.
Yes.
So the patient already has the genes of androgenic alopecia.
Yes.
So once you stop, the genes are working to reverse the condition.
Yes.
But it's not true for other diseases. We are using minoxidil for other diseases, and it is antifibrotic as well. In many cases of severe tinea capitis, we are using the topical minoxidil to reserve the follicles. So
Okay.
it's good treatment.
Okay, this is very good to know because some people, when they hear just minoxidil, they refuse to take the treatment
Yes.
as they think always that the hair will fall back again and there was no
It's
benefit.
an old fixed idea.
Yes, yes, this is very good to
Yes.
know. Okay, and one last thing I would like to ask you, doctor, how do you advise the patients who have alopecia areata to accept the disease, or how do you think they can deal psychologically with the disease? As you know, many who have affection in the scalp, in the eyebrows, it's not we always care about our physical appearance. So, how do you advise this patient?
Actually, we have to implement that complete counseling the patient for the disease, for if there is any associated comorbidities or underlying conditions such as atopic dermatitis, vitiligo, other autoimmune disorders, pernicious anemia. If there is any also other comorbidities regarding vitamin and mineral deficiencies, we have to check. Some also theoretically speaking that any inflammation or infection in the area of the head and neck, there will be a tendency for the alopecia areata. So particularly in case of kids, we found that maybe they will have error of refraction, they will have dental caries, they will have adenoid, tonsillitis. So all of this should be taken into consideration.
Yes.
Also, we have to check if the patient started the disease with a psychological trauma.
Yes.
This is also good to know, and it will put some pieces of the puzzle together.
Yes.
The patient himself or herself should be taught to live with the disease and to know about the treatment options, and it's a shared opinion with the patient how to decide about the treatment. We have many patients coming, many female patients coming with this problem, and she want to get pregnant. Is it safe to take this? Is it safe to do injection, intralesional injection? What about if a pregnancy happened? How should she deal with the pregnancy if she's taking even the newer immune modulator? They are contraindicated with pregnancy, so all of this should be counseled.
Yes.
On the other hand, when the patient is really having too much psychological impact, we can ask psychological support.
Yes.
So we refer the patient to the psychologist or the psychiatrist in case of we cannot deal with the psychological burden.
Yes.
Anyway, dermatology now it's connected with the psyche, and there is psychodermatology in almost every skin disease.
Oh, this is good.
So we take this into consideration.
Yes, this is important to know that it's not only alopecia areata. It's we have to take care of all the body organs and check if there's any other disease, and maybe refer to the psychologist as you mentioned. So I would like to thank you so much, doctor, for this informative podcast. And as usual, we always learn a lot from you, and cannot wait for our next episode with you. Thank you so much.
Thank you so much. Thank you.